Let us define first what is hearing impairment. When we say hearing impairment, it means having some level of hearing loss from just missing faint sound to not hearing anything at all, because a part of the ear, like the outer, middle, or inner, or the hearing nerve isn't working right, or there is a problem. Signs and symptoms of hearing impairment. Parents may suspect hearing impairment if the child does not respond to sound, or if the child has difficulty talking or has delayed speech. So, ito yung mga pinakaunang sign and symptoms ng hearing impairment kapag yung child is, noong bata pa lang siya, kahit na paulit-ulit mo siyang tinatawag, is hindi ka na nililingon or hindi ka niya pinapakinggan. And also, isa rin sign doon is kapag delayed na yung speech niya, na kahit for example is 2 years old na siya, wherein dapat na kapag sabi na siya ng mama or mga simple words is hindi pa rin niya nagagawa. So, meron pa tayong iba't ibang signs and symptoms ng hearing impairment. First bullet is children sometimes ignore people who are talking to them. So, ito yung sinasabi ko kanina na kahit kinakausap mo yung bata or kahit na paulit-ulit mo siyang tawagin is hindi siya lilingon or hindi ka niya sasagutin. That means meron na siyang parang hindi direct na meron siya kaagad hearing impairment, pero may mga signs na medyo mahina na yung pandinig niya. Next is muffling of speech and other sounds. So, pag sinabi nating muffling is medyo mahina siya. So, example nito is, for example na lang, kapag nagsasalita ka is nakasuot ka ng face mask. Medyo mas mahina yung boses mo compared sa pag nagsasalita ka kapag walang face mask. Next is trouble understanding words, especially when in a crowd or in a noisy place. Often asking others to speak more slowly, clearly, and loudly. So, medyo similar silang dalawa. Kasi, isa ring mga sign na for example is nasa crowded area kayo, sabihin natin is nasa parang mall kayo, sa crowded area. Kapag may sinasabi, yung for example is yung kaibigan mo sa'yo and medyo hindi mo siya naririnig, yan, hindi mo siya maintindihan to the point na i-ask mo na siya na magsalita ng mas malakas, mas clear para maintindihan mo siya. So, that means is medyo meron ka ng sign na medyo humihina na yung pandinig mo. Next is needing to turn up the volume of the television or radio. So, ito naman is kadalasang nangyayari sa bahay. For example na lang ay nanonood ka nga ng TV. Tapos, ang normal volume lang dapat ng TV is sabihin mga 10, ganyan. Pero, kapag ikaw yung nanonood, ang volume mo ng TV is parang 20 plus, 30 plus, or sometimes 40 plus, na sa mga kasama mo sa bahay is too much na siya, masyadong malakas, pero para sa'yo is medyo normal lang yung volume niya sa'yo. So, that means is meron ka ng hearing impairment. Next naman is ringing in the ears known as rhinitis or rhinitis. So, ito is kapag bigla-bigla na lang may mag-ring sa ears mo na parang wala ka nang marinig, kundi parang nag-ring lang siya. Yan.
Here are the causes and the characteristic of hearing impairment. Causes. Hearing impairment in newborns most commonly result from cytomegalovirus infection or genetic defects, and in older children result from ear infections or excessive earwax. So when we say cytomegalovirus, it is a common virus that usually doesn't cause symptoms in healthy people, and it is spread through body fluids like saliva and urine. Excessive earwax is when too much wax builds up in the ear, blocking the ear canal. It can cause ear pain, hearing loss, itching, or a feeling of fullness. Many things can cause hearing loss. For example, short-term or sudden exposure to very loud noise, like attending a loud concert, can affect your hearing. Conductive hearing loss causes include 1. Eustachian tube issues that trap fluid in your middle ear. So when the eustachian tube, a small canal connecting your middle ear to the back of your nose, gets blocked or doesn't work well, fluid can build up in the middle ear. This trapped fluid stops sound from passing through properly, leading to hearing loss. 2. Ear tumors. A tumor in the ear, either benign or cancerous, can block the ear canal or press on parts of the middle ear. So this blockage prevents sound from traveling normally, causing conductive hearing loss. Sensory neural hearing loss causes include 1. Aging. As people get older, the tiny hair cells in the inner ear naturally wear out or get damaged, making it harder to hear, especially high-pitched sounds. 2. Illnesses like coronary artery disease, high blood pressure, strokes, or diabetes. So these health problems can reduce blood flow or damage nerves in the inner ear, leading to hearing loss over time. Number 3, certain genetic inherited conditions. Some people are born with genes that make their inner ear more likely to get damaged, causing hearing loss either at birth or as they get older. And now let's move on to the characteristics of hearing impairment. So hearing impairment or hearing loss is characterized by the inability to hear sound as well as a person with normal hearing. This can manifest in various ways, including difficulty understanding speech, particularly in noisy environments, leading to increased volume for TV or radio, and even social withdrawal or difficulty with balance. Other symptoms can include tinnitus, ringing in the ears, a feeling of fullness in the ear and in children, delayed speech and language development.
So, let's tackle about the identification and assessment of children with hearing impairment. Early identification of a hearing impairment increases the chances for the child to receive early treatment and special education intervention. First is audiological evaluation. Audiological evaluation is a process used to check a person's hearing. It is part of the field called audiology, which is the science of studying and testing hearing. During an audiological evaluation, an expert called audiologist uses special tools and methods to find out if a person has hearing problems and if so, how serious the problem is. This evaluation helps in understanding the type and the level of hearing loss so the right treatment or support can be given. An example of audiologist evaluation is the pure tone audiology. This test uses beeping sound, pure tones, played through earphones, air conduction, or a vibrating device on the bone behind the ear, bone conduction. It helps measure how soft sound a person can hear, and it gives both quantitative numbers or levels and qualitative descriptive detail about the hearing loss. It is very useful in identifying the degree and type of hearing loss. The second example is speech audiometry. Instead of tones, this test uses spoken words or sentence. It checks how well a person can hear and understand speech, which is important for real-life listening. It gives more functional information like how clearly a person can recognize and repeat the sound. In summary of it, both tests are part of an audiological evaluation. They give a clear picture of a person's hearing abilities, helping audiologists accurately diagnose and plan treatment for hearing problems. There are alternative audiometric techniques for hearing evaluation. First one is sound field audiometry. Second is evoke response audiometry. Third is impedance audiometry. Fourth is plate audiometry. Fifth is operant conditioning audiometry. Sixth is behavior observation audiometry. Next is informal hearing test. Informal hearing tests are simple, quick, and do not require special equipment. They can be done at home or in a classroom to get a basic idea of a child's hearing ability before referring them to a professional for formal testing. First is whisper test. In this test, the child is asked to cover one ear with a finger or hand. The tester stands behind the child and whisper familiar words into the uncovered ear. If the child repeats the word correctly, it suggests normal hearing in that ear. This test checks the ability to hear soft, everyday sounds. Second is conventional live voice test. Here the tester faces the child and says words that contain different consonant sounds, high or low pitches. Start by speaking softly and gradually increase loudness up to 20 decibels. Move away slowly while asking the child to repeat the words. If the child can hear clearly from 3 to 6 meters away, their hearing is likely normal. If not, it could be a sign of hearing difficulty. The last one is ballpen click test. This test uses a retractable ballpen. One ear is covered and the tester clicks the pen about an inch from the uncovered ear. The child should respond by saying yes, nodding and raising hand. If the child doesn't react, they might have reduced hearing in that ear.
Now, pag-uusapan naman natin yung mga support and strategies na pwedeng gamitin sa classroom para matulungan ang mga estudyanteng may hearing impairment, pati na rin ang mga assistive devices na available para sa kanila. So, alam nyo ba na hindi lang teacher ang may role sa pag-support sa mga student with hearing loss? Kasama rin dito yung mga audiologists o sila yung mga eksperto na nagda-diagnose at nagtitreat ng hearing problems. May mga speech therapist din. Siyempre, pati yung parents ng bata at si student mismo. So, ginagawa nila is nagkakaisa silang gumawa ng educational plan, gaya ng IEP o 504 plan para matulungan ang bata na ma-reach ang full potential niya. Ngayon, pagdating sa classroom, mahalaga talaga ang strategies. So, let's break it down. So, una, make seating changes. Simple lang to, pero sobrang helpful niya. Yung mga estudyanteng may hearing loss, mas magandang ilagay sila sa harapan ng classroom, malapit sa teacher or sa area na tinatawag nating speech reading zone. So, bakit? Kasi maraming students na may hearing loss ang nagre-rely sa lip reading or facial expressions para maintindihan nila ang sinasabi ng teacher. So kapag malapit sila sa nagsasalita, mas may chance silang makakatch up sa lesson. Next is classroom arrangement. So mas maganda rin kung naka-U-shape or circle ang mga upuan. Bakit ganito? Kasi sa ganitong setup, nakikita ng estudyante ang mukha ng teacher at classmates niya. Mas nagiging interactive ang environment. At this setup helps them engage more kasi hindi lang sila nakatutok sa likod ng classmates nila. Nakikita nila kung sino yung nagsasalita. Tinutulungan din nito ang teacher na makita agad kung nalilito o kailangan ng tulong ng bata. Next strategy is minimize background noise. So, alam nyo yung parang akala natin, okay lang kahit may maingay sa paligid. Sa students na may hearing loss, malaking bagay yan. Kung may electric fan, open windows o nag-uusap sa labas ng classroom, naaapektuhan ang clarity ng sound. So, as much as possible, maghanap ng quiet area o ayusin ang setup para mabawasan ang noise. No? This helps both the student and the teacher kasi hindi kailangan paulit-ulit ang instruction at mas malinaw ang communication. Another strategy is use an FM system. So, ang FM system ay parang sound system na pang one-on-one. So, may microphone ang teacher na suot, tapos may receiver si student. So, kapag nagsasalita si teacher, direkta itong marinig ng bata sa hearing aid o speaker niya. Ano ang benefit nito? Hindi na naaapektuhan ng background noise at malinaw na malinaw ang boses ni teacher. So, perfect siya, lalo na kung nasa malaki or maingay na classroom kayo. So, another thing is always face the student when you speak. So, lagi nating i-face ang estudyante kapag nagsasalita tayo. Huwag tayong magsalita habang nakatalikod sa kanila o naglalakad sa room. Kasi nga, again, sinabi ko kanina, marami sa kanila ang nagre-rely sa lip reading at facial expressions. Mas naiintindihan nila kung malinaw ang pagkakabigkas natin at nakita nila yung bibig natin. Hindi rin natin kailangang sumigaw, kailangan lang malinaw, kalmado at may eye contact. At next tip is use visuals. So, gumamit ng pictures, ng graphics, ng text, labels, kasi most of them are visual learners. Kapag meron silang makikita na image or keywords habang nagle-lecture kayo, mas tumatatak sa isip nila. Halimbawa, kung nagtuturo ka ng science topic, ipakita mo yung diagram, hindi lang basta explain, no? This helps them process the lesson better and faster. Ngayon, let's move on to the assistive devices na ginagamit ng mga taong may hearing impairment. So, una na dito is yung hearing aids. Ito yung pinaka-common. Maliit na device na suot sa loob o labas ng tenga. Ang function nito ay i-amplify o palakasin ang sound para mas marinig ng bata. Pero take note, hindi nito binabalik ang normal hearing. Tinataas lang nito ang volume ng tunog para mas marinig ang speech at ibang sounds. So, effective ito lalo na sa may sensory neural hearing loss, meaning may damage sa inner ear. Pero kung ang problema ay nasa mismong nerve or brain interpretation ng sound, may limitation ang hearing aids. Next is cochlear implants. So, ito ay yung mas advanced na technology. Hindi siya basta suot lang. Hindi katulad ng hearing aids kanina. Surgically implanted ito. So, ini-install ito sa loob ng tenga at kumukonekta sa auditory nerve. Instead of amplifying sound, it directly sends electrical signals to the brain para maramdaman at maintindihan ng bata ang tunog. Usually, ginagamit ito sa mga batang may profound hearing loss o yung tipong hindi na kaya ng hearing aids. So, malaki ang naitutulong ng cochlear implants sa language development at communication skills. Mas nakaka-adapt sila sa mainstream classroom at nakakasabay sa lesson. So, ayun lang. Mahalagang tandaan natin na ang hearing impairment ay hindi hadlang para makapag-aral ng maayos. With the right strategies and assistive tools, may iwasan natin ang isolation at matutulungan natin silang maging confident, engaged at successful sa klase. Tayo bilang classmates at future professionals, dapat maging aware, sensitive at proactive sa mga needs nila. And that's it. Thank you.